My name is Dr. Debolina. I'm presenting on the role of septicaemia and surgery in preterm babies during the NICU stay towards ROP. As we know, ROP is an upcoming vascular proliferative disorder that is an important cause of childhood blindness. We are specifically studying on the role of early neonatal surgeries these babies undergo during their stay in NICU, specifically surgeries like inguinal hernia, necrotizing enterocolitis, and hydrocephalus, because they undergo these surgeries under general anesthesia, requiring prolonged mechanical ventilation and also need additional blood transfusions. So these possibly add to the risk of ROP, as I'll demonstrate in the study. So we evaluated descriptively the role of septicaemia and early neonatal surgeries undergone by these babies during the stay in NICU on the progression of ROP. This was a prospective study done over 3 years from 2018 to 21 in a tertiary care center in South India. And we included 142 babies with any stage of ROP, which were included based on the IC-ROP classification and subdivided based on ET-ROP classification. We started screening from day 21, and we were studying 11 risk factors between the babies, and specifically we were noting down the post-conceptional age at which ROP was first detected, started regressing, and completely regressed. And we also saw the post-conceptional age at which these babies underwent these early neonatal surgeries. Statistical analysis was kept, we used the various statistical tests, and the p-value was kept as a cutoff of 0.05. Coming to the results, we saw 16.4% babies developed ROP, most of which were male patients, and out of which 53 babies had type 1, progressed to type 1 ROP, including 3 babies with AP-ROP. Most of these babies needed peripheral laser ablation, and 2 additionally needed anti-VEGF injections. So this is based on the ET-ROP classification. We saw most of our babies had type 2 ROP. Comparing the risk factors between ROP and no ROP, we saw low gestational age, low birth weight, RDS, apnea, prematurity, prolonged mechanical ventilation, sepsis, anemia, transfusions, ileus of prematurity, and early neonatal surgeries were statistically significant with babies with ROP. Comparing the same risk factors between the subgroups of ROP, we saw definitely a low gestational age, birth weight were typically seen in type 1 ROP. Again, RDS, apnea, prematurity, prolonged mechanical ventilation were associated with type 1 ROP, and these were all statistically significant. PDA, sepsis, anemia, blood transfusion, and surgeries were also typically associated with type 1 ROP. These are the pictures which I'll skip for the now. Coming to the descriptive frequency of sepsis, we saw amongst the babies with type 1 ROP, they had more of gram-negative bacilli, which is Klebsiella pneumoniae, and type 2 had a combination of type gram-positive and gram-negative, that is Acinetobacter and Staph epidermidis. Coming to the frequency of the various surgeries, as we've already demonstrated, type 1 ROP babies had a greater number of surgeries, early neonatal surgeries, and most of these babies underwent inguinal herniotomy. Coming to the babies with type 2, they also underwent inguinal herniotomy, and mild ROP, also one of them underwent congenital diaphragmatic hernia repair. Now, this is the main thing which I wanted to demonstrate is, we demonstrated the timeline when the baby was diagnosed with ROP, when the babies underwent the surgery, when it started regressing, and it completely regressed. Over here, we can only see for type 1 ROP that there's a positive up curve. So we are seeing that the babies are undergoing surgeries in type 1 ROP between 34 to 35 weeks, and there's a progression seen at around 36 weeks. So we can possibly demonstrate that the role of surgeries is possibly playing a role in the progression in type 1. Coming to our study, to the discussion, so 37.3% of the babies in our study progressed to type 1, which is similar to the study done by Imran et al. This is due to the similar screening criteria, as we also included babies with birth weight less than 2,500 grams and less than 34 weeks. Type 1 ROP definitely had a lower gestational weight and birth weight and needed a long mechanical ventilation support. Sepsis particularly was a strong risk factor, and as I've already shown that Klebsiella pneumoniae was a strong associated factor. And none of the babies with mild ROP had any septicemia associated. Coming to the demonstration of how this is possibly affecting ROP is, these microorganisms are releasing toxins which come out of the leaky retinal vessels, causing a retinal microthrombi, leading to retinal micro non-perfusion. Also, it adds on to the oxidative stress at the retina, which increases the VEGF levels, causing neovascularization. So 24 babies in a study, in total they underwent these neonatal surgeries during the NICU stay, out of which 66.7% progressed to type 1 ROP, 25% developed type 2 and 8.3 developed mild ROP. And we noted that 3 of these babies developing type 1 underwent more than one surgery. We also noted babies had a progression of ROP after surgery in the group with type 1, as I showed it in the graph. So coming to the literature, they say that inguinal hernia in preterm infants below 33 weeks has been estimated around 13%, which we can also see the most common surgery done in the cohort of our babies. And the time of surgery is controversial because they say that the hernia should be operated early in these babies to avoid complications. But again, it's a debate between the pediatric ophthalmologists and the pediatric surgeons over here. So how these surgeries possibly are affecting the eye and ROP is possibly because they're going under general anesthesia, needing a prolonged mechanical ventilation. I'll just come to the conclusion, sir. So the purpose of a study was to monitor these preterm babies undergoing any surgical interventions during the NICU stay and to follow them up more frequently, specifically between the age 34 weeks to 39 weeks, because that's when they're undergoing the surgery, and that is also the time period when the progression of ROP is noted. Thank you.
Thank you. So
why they were doing hernias in this age group? Can't they wait? I mean,
so that is the thing. A lot of pediatric surgeons, they do say between, there are two schools of thought. Some say that you should do it before, some say you can wait and come for another after the baby is discharged. But in our hospital, they prefer that while the baby is in the NICU, you do it. And a certain people also say that if you prolong it, there's chances of incarceration, testis incarceration. So they don't want to wait for after later age.
Hernias are not, I think, such a serious matter. I don't know much about hernias.
Yes, this is something which we observed.
But I think it should not be such an emergency to my
Was general anesthesia responsible for?
Yes, ma'am. Because of general anesthesia, the baby was kept in the NICU on prolonged mechanical ventilation, and most of these babies also needed additional blood transfusions. So these also possibly indirectly added on to the oxidative stress on the baby.
And they are premature children, their immune system, everything is compromised. I think that's also it's a multifactorial thing probably.
Yes,
then
yes,
it's not easy to pinpoint that probably there's one reason for the whole thing.
Yes, so that's why it's a debate between the pediatric surgeons
Yes,
and
true.
Thank you.
And they always want to do early surgery. Their trend is to do early surgery, so that's the problem, I think.